Riza here for another episode of Empowering Dementia Caregivers podcast. Globally, every 3 seconds, a person develops dementia. In 3 minutes, 600 people are already affected. In 3 hours, 3,600 people are affected. This is happening globally. It is so important for your loved one to get diagnosed with their dementia symptoms. A dementia diagnosis helps you as a caregiver and your loved one to get the covered dementia care benefit through your healthcare insurance and community resources that are serving seniors in your community. Medicare covers certain number of hours for private caregiving services. To qualify for this benefit, your loved one has to have a dementia diagnosis. Here are the pointers on how doctors diagnose Alzheimer's and other types of dementia. Doctors use a combination of testing tools in diagnosing Alzheimer's and other types of dementia. With advancing medical research in finding the real cure for Alzheimer's disease, these testing tools are also used to detect early stages of Alzheimer's disease, which is very crucial in dementia prevention. With timely and appropriate treatment interventions, the early stage of Alzheimer's disease, which are the early signs of dementia symptoms, they can be treated and can be reversed. Doctors do check your loved one's medical history. They check your loved one's past medical condition, history of memory changes, family history, and current medications. Physical exam is done, checking your loved one's overall health. So they checked the heart, lungs, physical activity, nutrition, and diet. Neurological exam is also done, checking your loved one's balance, coordination, and speech. Doctors do lab tests. Lumbar puncture, more known as the spinal tap testing, it is done by drawing cerebrospinal fluid in your spine to detect the increase in protein plaques buildup, which is the beta amyloid, the hallmark of Alzheimer's disease. These protein plaques are toxic proteins in the brain. Blood test is less invasive than the traditional spinal tap testing. Mayo Clinic is a huge supporter and sponsor of Alzheimer's Association. Mayo Clinic recently developed a blood test that can detect biomarkers in the brain that are key characteristics of Alzheimer's disease. In addition to a blood test, Mayo Clinic uses the cerebrospinal fluid testing to evaluate for brain changes related to patients with diagnosis of mild cognitive impairment or early stage of dementia. The most sophisticated brain imaging used to diagnose Alzheimer's disease and other types of dementia is a PET scan. A CAT scan and MRI scan imaging can only show the physical structure of the brain, whereas the PET scan can show both the physical structure of the brain and the cell activities in the brain. PET scan can also detect the protein plaques in the brain. PET scan was not covered by most insurances because it was costly. Now, this is a good thing. Now, Medicare covers PET scan for diagnosis and monitoring of Alzheimer's disease. Mental testing. Mental testing is used to check your loved one's memory and thinking skills. Medicare covers annual wellness visit for your loved one over 65 years and older. Mental testing is part and it is included in the annual wellness visit. So I encourage you to request the mental testing during your loved one's annual wellness visit, especially when you are noticing the early signs of memory loss. As a physical therapist and dementia consultant, I use mental testing in my evaluation and coaching services. The mental testing helps me to identify your loved one's memory impairment, so then I can make recommendations to refer your loved one to a primary doctor or neurologist for further evaluation and testing. Mental testing tool also helps me determine the stage of dementia of your loved one, and I use it as a guide on establishing functional goals that I can still work on and your loved one can improve. And setting realistic expectations based on your loved one's physical and mental ability, as well as in coaching and educating the caregivers. Genetic testing. It is only recommended for people who are high risk of developing Alzheimer's disease. So if you have a loved one diagnosed with Alzheimer's or other types of dementia, you are considered a high risk and would qualify for genetic testing. Before the breakthrough of these innovative testing tools, the only way that Alzheimer's disease can be diagnosed is in a brain of a dead human body affected by Alzheimer's disease. Great things are coming. Doctors, Medicare, healthcare insurances, Alzheimer's and dementia organization advocates are working together to cure and ultimately to end Alzheimer's disease. Getting your loved one checked by a medical professional to get a dementia diagnosis and get their dementia symptoms addressed, it is now highly recommended and highly encouraged. So your loved one can get a timely and appropriate treatment intervention. And it is in the early stage of dementia that we can help you reverse these symptoms and prevent the progression of Alzheimer's disease. I offer a 30-minute free consultation as a physical therapist and dementia coach to address your concerns with your loved one's early signs of memory loss and guide you in getting a dementia diagnosis. Be empowered, dementia caregivers. Till next time.